Yes, I hope you can see the slides. Yeah, perfect.
Perfect.
Yeah, so thanks a lot for the invitation. I'm really curious about the discussions afterwards. So please feel free to ask any questions or give me feedback. I think I hope I learn a lot here as well, also during the informal conversation afterwards. My background is mathematics, so I've studied mathematics and then computer science, and then came kind of in the healthcare, medicine, imaging field, and a lot in that area has changed during the last couple of years because of the advances in machine learning and in artificial intelligence, but very in particular because of the advances in machine learning and deep learning. And one thing which was kind of interesting for me to watch is that I think many of you know the name Jeff Hinton, and at some point he said that it would be a very dangerous thing to continue educating radiologists, because he believed that a lot of what radiologists do would be kind of taken over by artificial intelligence and by models that came out of the machine learning community. And that caused quite an uproar and a lot of very deep conversations across the radiology community. And ultimately, I'm part of that community, because what we are doing in our lab and also in contextflow is kind of happening in this context of diagnosis, of trying to find ways to inform treatment decisions and patient management decisions out of what we can observe in patients. And one of the effects of that was that in many of these conferences where thousands of radiologists come together, they had kind of these audience questionnaires where people could kind of vote what they would like to, what they think is true and what they think is false. And that questionnaires like, well, how long do you think it will take until we are obsolete? Will it take 1 year or 5 years or 10 years? And actually, they were quite pessimistic and thought that like in 5 to 10 years, AI would pretty much have taken over the field and the job of a radiologist would be kind of be automated away by artificial intelligence. And that was, I think, interesting to watch. But I think was even more interesting was what happened in the years between then and now. So in the last couple of years, a big part of the discussion changed. And this question whether AI will automate away radiologists is really kind of not asked anymore, because everybody, I think, understands that that will not happen. And what I'd like to talk about today is basically a couple of the reasons why people are very confident that that is not happening, because I think these reasons are interesting, because they are about what is the role of artificial intelligence in medicine and in precision medicine, and in particular in radiology, because that was one of the fields where AI and machine learning, I think, took foot first and where the first results came up. And I think the reasons why now everybody is seeing AI not so much as a competition to what human experts can do, but rather kind of a complement of what human expert can do and what it can actually contribute. I think that's an interesting discussion to have. And we are by far not finished with this discussion. But what I'd like to do during the talk today is to give you a bit of a sense of where we are in medicine. And I'll start with a very high level to give you some ideas about the positioning of AI and machine learning in medicine and what it can do and what it can contribute to. But then we'll go into more detail in imaging, because that's my field, and there I can tell you a bit more about down to the algorithmic details, what's relevant and what's happening and what is changing there because of the capabilities of AI or because of the expectations of what AI can do. And then we'll kind of, at the end, look at a couple of examples. But I'll sprinkle examples all the way through the talk, so, to give you some kind of more concrete sense of what it means. So I called the talk Automation or Exploration, because I think that was the main kind of conflict that was resolved in these last couple of years. First, we saw artificial intelligence as something that could automate what experts do. And I think right now we are more and more understanding that automating something that people do right now is not really the thing that we need, because everybody knows that, or people understand that we are far not at where we would like to be in being able to predict what would be the best treatment for a patient, what would be the best patient management for a patient, but we need to become better. And so I think the better place or the better role for AI is actually in helping to do that. But before we dive into the details of medical imaging and diagnosis and how AI can help there, that you give me a bit of a kind of bird's eye view where the discussions are going on, where artificial intelligence could help. So one of the big topics, and that is what we will talk about, is that AI is expected to have a big impact on diagnosis, on the way of transferring what we can observe in a patient. That might be imaging data, lab data, patient history, information about prior knowledge, about prior treatments, into something that we have to do with the patient. So what is the best treatment? What is the best management or observation strategy for a particular patient? And a part of that is because we are understanding diseases better and better, and realize that we need tools like artificial intelligence in order to help us to fit the treatment to the particular disease. A second impact where I think a lot of benefit will come from AI is an enabler of delivery. So we will be able to compensate for some shortages, and we have shortages across the entire healthcare spectrum. To compensate for that with the help of AI, be it diagnosis or be it the delivery across the entire world. I think cost saving is another factor that's definitely relevant, more I think in enabling to deliver more. And the last one that is a particularly interesting question, because I think it's also concerning the question of for whom artificial intelligence will actually bring a benefit. So is it just kind of first world countries with big hospital clinics, or is it also something that can benefit other areas, other types of healthcare that might be benefiting from the fact that AI might be a tool to pool knowledge, to bring and bridge and transfer knowledge, transfer observations or the gist, the evidence that coming out of observations that we make across the entire world, across different patient populations, so that if there is one patient and one doctor, they can use this knowledge that is encoded in models, that is encoded in big databases, that it can be used for the diagnosis of one individual in order to make a treatment decision. So these are the points where I think we will see a lot of benefit. And some of them are at a very early stage, and some of them are at a bit of a later stage. So enabling population health, predicting something from a lot of different factors. I think that's fairly early, delivering that to frontline healthcare workers, like providing something like a virtual health assistant that really ingests a lot of information and produces a suggestion or guidance, is a bit more advanced. But one thing that is relatively mature, we see right now a lot of companies already kind of providing products that are certified that can enter the routine care system, is the support in clinical decisions. So how can we translate the data that we are able to observe into decision support for clinicians? That's what most of this talk will be about. But before I go into that, I'd also like to highlight a couple of challenges, because a couple of challenges are, of course, technically, and like a huge community of researchers, and I'm sure some of you are part of that community, is working on getting better methods, getting better ways of integrating data and of exploiting different types of data. But some of the challenges are really beyond technology. Like, for example, how can we make sure that AI remains fair, which is especially relevant in healthcare? How can we ensure that the models that are actually supporting decisions are not only working on a part of the population, but on a kind of as wide as possible part of the population? As soon as we integrate healthcare AI into the development of new treatments, we also have to take care that these new treatments serve a wide population, the widest population as possible. We realize that the integration of these solutions into healthcare is difficult. And that is because while the technology, while the algorithms, and that's kind of the saying, is a bit global, like, I mean, support vector machine or convolutional neural networks works no matter in which country, but the actual healthcare, the implementation is very, very local. So the regulations that kind of control how easy it is to implement these solutions in place are very heterogeneous across countries, across regions. And so that is also something that we have to take care of when we try to actually bring that into practice. And the other thing is, of course, that during the development of these approaches, both during the development and also the deployment, different levels of data privacy law, different levels of data protections are in place, and we also have to take care of that, because, of course, there is always a trade-off of the risk and the benefit that comes from integrating these kind of data into models, because the more data you have, the more robust these models are, but also that might increase the risk if it's not done properly. But I'd like to kind of leave that high level there and now go into a bit more detail about what our job is, or what the job of AI is in the diagnostic field, or how we can view that in order to get a grip on what different approaches are centered around and what they try to deliver in order to support decisions. Because supporting decisions is a very general term, but what can AI really do in that? And one image I find helpful is that a lot of what artificial intelligence and machine learning can do in order to support decisions is actually prediction. So when you have a couple of data points, a couple of observations about a patient, and that might be imaging, but the technology for acquiring this data is also advancing very rapidly. So we are able, also on a routine basis, we are able to acquire imaging data, genomics data that's relevant for some of the diseases, lab data, really a lot of data. And right now we are struggling to use only a very small bit of this data. So the task here is to take this data and perform good predictions. And the predictions should tell us what will happen with the patient in the future if we don't treat. That's relevant if we are just observing, if you're trying to do prevention, if we are observing, if we have to do something in the future and want to just manage a patient and tell them, well, you can go home and just come back in the next 6 months or in the next 12 months, or you should come back in 2 weeks because we would like to have a closer look if something develops. So that's one type of prediction. And the second prediction is about, we would like to predict what happens to a patient if we apply a certain treatment for a certain period of time. So we would like to know something about the response to a treatment for a particular patient, a particular disease, and a particular treatment. And that gets more and more relevant because the treatment landscape broadens. So we have more and more different treatments available. And if we are entering the area of combination treatments, it's really a very wide spectrum of things we can do in order to help patients. But it also turns out that it's tricky to find the right treatment for a particular patient. We need to translate what we can observe into these suggestions and into predictions what might be the a good treatment. And sometimes that also means starting with one treatment, learning about how this treatment works, and then switching to a better treatment. And so one thing that I think it's important to have in mind, this is something that should help during the treatment of individual patients. So we would like to have these prediction models, and I'll show a couple of examples to actually give you a sense what that actually means. So we would like to have these prediction models when we are in front of a patient and like to decide what's the best treatment. But it also has a flip side, because every time we are able to predict something for a patient, that also means there is a phase when the treatment was developed, and during that early phase of treatment development, of studies that evaluate whether treatment works or what's the particular kind of section of the patient population for whom this treatment works, there is kind of an equivalent place for artificial intelligence, because while we are developing treatments, we can use these prediction models in order to find signatures in the patient population that are a signature of future response to a certain treatment. And these same signatures are also a tool in order to actually figure out whether a treatment works or it does not work during a trial. So AI has both a role in the treatment of patients, if we have treatment options, but also in the development of new treatment options where we need tools in order to be better able to differentiate between different response patterns. And machine learning is a great tool for that. And I think there is a big road in front of us in advancing these tools. But the basic principle of machine learning, kind of maybe extremely simplified, is that we want to learn models, we want to train models that are not kind of handcrafted rule and engines that perform a certain rule combination in order to kind of take an input and produce an output, but we like to train models that learn based off an example. And typically in medicine, these examples are of the form that we have some input, like for example, imaging data, and we have some output, like for example, if there is a lesion in this image, or if this is a certain disease, or where this lesion is, that is the output. And the model should learn from a lot of training examples in order to be able to replicate this labeling, telling us where a lesion is in an image based on new data. And when you are coming from a more general machine learning background, then you're used to data set sizes of millions of images of cats and dogs and horses. But in medicine, our data set sizes are typically a lot smaller. So for some of the diseases, there are not even that many patients. So we need to make advance, and a lot of the advance in the last couple of years was helping to enable these models to learn from less examples. helping them to figure out, to separate the variability in the data that is associated with just natural variability between individual human beings and variability that is really kind of attached and associated with the disease. And so I think these are the two main differences between a lot of what we see in more general machine learning literature and the part of the literature that really focuses on medical data. Typically with medical data, we have to cope with the fact that we have smaller training data sizes. And the other thing is that there is a huge amount of natural variability that is not really relevant for the disease or for a possible response to a treatment. So we have to separate these two kind of signals in the data, and a lot of approaches, or kind of a lot of advance came out of there. So let's have a look at a couple of examples about where we are. So things that machine learning can do are, for example, supporting us in reading complex imaging data. So what you see here, that's a magnetic resonance imaging data set of a patient. So that's essentially a cut through the entire body out of a 3D data set. And the goal here is to find lesions in this patient. So these are multiple myeloma patients. That's a cancer type that is affecting different organs, but also the bones. And so what we would like to have is, instead of a physician, a radiologist having to go through this entire stack of volumes, which would take a long time, have a machine that tells us where are candidates in this volume where actual lesions might be sitting. So what you see on top is basically the data set, and two green circles mark the regions of actual lesions in this patient, so actual tumors in this patient. And on the lower part, you see basically the automatic result of the parsing of this volume data when it comes in, where an algorithm that has learned from a fair number of these data sets where lesions are and how lesions look like, to actually make this distinction and say, well, these are candidate lesions, candidate regions for lesions. So here the job of AI is really to kind of perform a parse and save time for the assessment of this data afterwards. Another application is, and this is a breast cancer patient, to fuse different information. So what you see here are breasts imaged by computer tomography, by PET imaging. So that's a nuclear type of imaging where you inject a tracer that essentially marks metabolism in the body, and different types of magnetic resonance imaging data. And here the job is really to integrate all of this information and enable a model to say, well, there is no lesion here, or here is a lesion, and this lesion is most probably a malign lesion, cancer type, where we need to do surgery, or this is a lesion where we don't have to do surgery because it's a benign cancer. So these jobs of detection, like in the previous slide, segmentation, classification, these are all things that artificial intelligence and machine learning, and especially this new, or by now not even new anymore, this field of deep learning, can do very, very well, because they are very well suited to process imaging data, to process complex imaging data, and to learn to detect and segment and classify the imaging content. This is in the area of doing a bit more than we did before, because they can integrate different information, but essentially it's looking for things that we know are there and that we know are relevant for the disease. The thing is, I think we can go a bit beyond that. And one of the inspiring works outside of medicine was work of that we can not only use machine learning for the classification of data, but we can also use it for translation tasks. And once you use it for translation tasks, there are a lot of things in medicine that you can actually view as a translation problem. And so here I have an example by work by Xu et al., where they basically worked at algorithms that could translate between photographs and paintings of different styles. So even though they did not kind of hire Van Gogh and other painters to paint them a couple of hundred training examples for images that they had in front of them in order to train an algorithm to translate between them, they just had photographs and images of different paintings by different painters, and still they were able to train models that could kind of simulate this transfer of the style from a photograph to different painting styles. And something very similar is actually helpful in medicine. And there we are now not anymore in the area of prediction, or not anymore in the area of classification, but really in the area of translation. And when you think a bit about it, suddenly the job of AI does not become just saying, well, that's there, or that's not there, or that's this type, but really you open up the application fields of AI to a bit wider spectrum where it can actually help human experts to perform the task better by translating the information that is in front of them into something more useful. And so this is one example where from an X-ray, so that's a chest X-ray, what you see is kind of the spine in the middle, the two lungs on the two sides, and you see indicated by the arrows, there are structures that we see that we are not interested in right now, because we are really interested just in the lung, because we are interested if we see lung cancer or any other anomalies in the lung, but we see these bones, we see other structures like the liver that occlude parts of the lung that we would be interested in. And we can now train models to actually recognize what part of these observed signals comes from these kind of occlusions, and kind of subtract that from the image, learn what we are interested in, and then learn to extract that relevant information out of the information bucket, in this case, an X-ray. Another way of using this idea of mapping from an observation to something that's useful is that we can train these models, and that's some work by Roxanne DiSandro, to say, well, one way to say what I could ask AI to do for me is to say, what other lesions, is there any problem in this image right now? But another thing that you could ask it is there anything that looks like there might be a problem in the future? Are there any subtle kind of imaging signatures that might not have names, but that might still be a sign that something will happen for this patient in the future? And so what you see here is again, kind of a coronal slice that's kind of this vertical front to back slice of an magnetic resonance imaging data set. What you see here are the legs, so the upper part of the legs. These dark things are the muscles. You see the bones, you see the fatty tissue around the muscles. And here the question is, are there any early signs of lesions that might pop up later? And so when you're talking about translation between one image to another image, you can also say, well, I just pose the translation problem not as a problem between images and images with less occlusions, but I say, well, try to learn to translate images into risk maps of what might happen in the future at this particular position. And what you see here is basically risk maps of where the bones, even though they look quite normal or are kind of below the threshold of being clinically relevant for decisions right now, even though that's the case, these types of bones, these types of local texture looks like something might happen in the future. And it turns out that this is actually the case. So you can kind of generate early markers of very subtle changes that point into something in the future. And this is now where I think we translate over from automation into exploration, because now we have no idea of what are, like before we train the models, we don't have the idea about what we should train the models on. We don't know what's the visual signature of a future lesion. We don't know what's the kind of subtle pattern change that might indicate that there might be something happening in the future. And so I think now we are kind of transitioning into this paradigm of saying, well, let's see if AI can help us broaden our vocabulary of visual signatures that we can use in order to do something useful to predict something about the future of the patient. And I show you another example that's from lung fibrosis, and that's a couple of images that were shared by Helmut Brosch. And lung fibrosis is a disease that's affecting the lung, that's kind of characterized by a couple of patterns and tissue changes that are happening in the lung, but it's very poorly understood in terms of diagnosis. So there is a lot of research going into understanding what are the signs of this disease progressing, what are the signs of this disease responding to a certain treatment. And one of the kind of key things here is this change in the lung tissue that kind of makes it look strange. And people have invented a couple of names for these changes, but it turns out that when you ask lots of different experts to assess a certain kind of lung, they actually don't agree a lot. So there is a lot of uncertainty about what type of pattern is present and what type of pattern is not present. Another thing that is happening is that when you actually have identified a certain pattern, it turns out that patterns with the same name might actually be coming with very different diseases. So it turns out that this vocabulary that we are using right now is just very limited in terms of capturing signatures patterns that are part of this biological process that is the disease. And so here the hope is that we can use machine learning in order to expand this vocabulary and actually, sorry, I'm just looking at the slide, expand this vocabulary. Can we, since now in these types of patterns, the main kind of necessity was to explain patterns to human expert, to teach young radiologists, well, this pattern looks like this and that. For this type of assessment of images, that's a good vocabulary of patterns. But since now we have machine learning tools at our disposal, we can have a second look and ask, are there other types of patterns, other types of sub-patterns that we can access with help of machine learning tools? And imaging is one example, but of course that's applicable to all kinds of diagnostic information where we see that individual parameters might be predictive, but actual much more prediction power might be in the combination of different parameters. But let's stick with the imaging example. And so in the next couple of minutes, I'd like to show you how we can go about expanding this vocabulary of images that we are using for the diagnosis. So can we go beyond what we have as established markers right now? And one thing that we can do is, for example, unsupervised learning, where we ask not so much kind of predict the label as we show you in the training set, but where we just present the machine learning algorithm with lots of examples and ask it to identify structure. Are there pattern types that happen over and over again in a large population of patients? Because they might be marker candidates for disease progression. And we can then ask, well, if you observe them, are some of these patterns stable and are other patterns actually progressing with disease very often, very similarly across different patients? Because then we might be after one of these marker patterns that are actually associated with the disease. That might give us a grip on what is happening, but it might be also helpful in deciding if this patient is a candidate for a certain treatment or not. And in practice, this looks like that, where you have kind of a labeling of the lung into different types of patterns, where a lot of these patterns are associated with normal lung tissue, but where we see a couple of patterns like this green one on the right upper part that is expanding and that seems to be associated with the disease. And that in turn then allows us to say something about kind of pathways that these diseases take in transitioning lung tissue from normal tissue to kind of very heavily diseased tissue. So we can expand the vocabulary of markers that we have, and I showed you an example from imaging data, but I think right now we are really experiencing in a lot of work that goes beyond imaging data into genomics data, into proteomics data, into other lab data, where we are now seeing that we can exploit machine learning in order to make sense out of this data. And there, I think it's important to step back a bit and say, well, making sense might mean two things. One thing might be that I just, for a patient in front of me, I'm able to predict what will happen to this patient in a year or in 2 years if I treat this patient with treatment A, B, or C. That's one thing that's already quite helpful. But the second thing, and I think that becomes, or is starting to become more and more prominent in the discussion and more important, is that with these machine learning approaches, since we are now able to identify these transition patterns because they are a tool for the prediction models, we are also discovering something about the disease mechanisms. And I think that's the second job of AI in medicine. It is to not only predict for individual patient and help routine imaging or help routine decisions, but also to inform our understanding of the biology that is happening at the kind of base of these diseases, right? So we would like to inform biology, we would like to inform our understanding of these diseases, and that is happening in the form of hypotheses that are being generated. Here, just another example. I think I'm running close to my time limit. So this is a prediction of so-called acute respiratory distress syndrome, where Johannes Hofmanninger and Sebastian Röhrig and many colleagues asked the question, well, if we can use machine learning to exploit any signature in the imaging data, does that also mean that our prediction accuracy really goes beyond established scores? And it turns out that that's the case. So this is an ROC curve that tells us basically how well this algorithm is suited in order to make prediction about the future, how accurately it can predict what's happening to this patient. And the blue line, like the further left up you are, the better. And it turns out with this prediction model that exploits subtle signatures in lung imaging lung CT data of patients when you just come to the hospital and you do the first CT scan, these signatures are actually able to predict risk for this distress syndrome with much higher accuracy than established scores. So I think in the last 2 minutes, I'd like to talk a bit more about these anomalies, this separating between the variability, because until now we just discovered a couple of signatures. They were predictive, but one of the questions that we would like to know is what type of these signatures is just associated with normal variability and what type of the signatures is actually associated with the disease, what's really an anomaly. And here I'll go into a bit of algorithmic detail because I think it's a very beautiful kind of type of method that was developed by Thomas Schlegel and Philipp Seeberg, where the idea was, well, I can do unsupervised learning and I can perform so-called generative modeling. So I can create generative models that train from a set of normal data and then are able to create to kind of fake data of the same type. And the way they do it is to kind of have a ping-pong match between the generator model and the discriminator model, that kind of where the generator model becomes better and better at faking real data and the discriminator model becomes better and better of discovering the fakes and therefore gives it kind of a fluid and evolving loss function. But the result of that is a generator model that can create medical imaging data that looks very, very realistic. That's interesting to see, but it's really also very useful because now we have a tool where we can take new imaging data and ask the model, try to get as close as possible to this new imaging data example as you can, and then we compare the difference. And the difference is what you see here in red. This is kind of the residual error, and this turns out to be great candidates for anomalies, even if they are anomalies that we don't know until now. And then we can look into this space of anomalies, into this set that we have discovered, and look whether there are groups of anomalies that happen over and over again, and again ask if they are associated with a specific disease. So we can learn from normal imaging data, from healthy control imaging data, to model the normal variation, which is huge. And then since GANs, like these generative adversarial network type models, are powerful enough to capture this variability, they become specific enough in turning us to the points where the actual observations for a patient kind of deviate to an extent from this normal variability that we can really say, well, that's a candidate for an anomaly, and we can then test whether this anomaly is actually associated with a disease. And so with that, I'm running out of time a bit, but I'd like to close with a couple of thoughts of what might be upcoming challenges. So one challenge that is not really upcoming because it's really already here is the data that we use for this training. So I think we need, of course, more data, but we need to train on more diverse data. I think right now the data that is used for lots of these projects is coming from very big university centers, very big research centers. And I think what is happening right now and what's very important is that there is a culture of sharing data and pooling data so that the diversity of the real population is reflected in the models. And we also learn that there are actually a couple of steps from knowing that there is some data in the clinic to actually coming to a data set that is suitable for learning these models and that is also kind of controlled in terms of biases that come from the data source, the way we select this data, and so on and so on. So I think when you're looking at work about machine learning and AI in medicine, look at the section that describes how they collected data, how they selected data, and if there are causes for biases in there. The second thing that is upcoming is that we need to think about the time when the first generation models will be there. What happens to the update of these models to the reality of clinical routine, because we will need to update these models to changing treatments, to changing diseases. And the last thing is, I think we still need to work a bit on finding the right role for AI in different workflows. And they might be very different for different disciplines. They might help us to make an initial guess, to help us to route patients to the right specialist, but they might also be a tool in order to give a second opinion for actually checking and safety checking the input by specialists or the diagnosis by specialists. And with that, I'd like to close with a very brief video how the project that started our university that then went into contextflow kind of approach that, which was by organizing large databases of cases into knowledge bases that are accessible from individual patients, where you can have a look at your patient, mark up regions, and then look into the large populations if there are any cases that are similar in order to support diagnosis, in order to make this knowledge kind of accessible to specialists during their routine work. With that, I'd like to finish and like to thank you for your attention, and I'll leave that slide open maybe while we have the discussion. I think we'll see a lot of impact of machine learning and AI in medicine, in precision medicine, in becoming better of delivering specific treatments to patients that will benefit from them. But I think we'll also have to be aware of the challenges that come with that, making sure that the data and the models that are resulting from the data are diverse enough and accurate enough, and also lead to understanding of the underlying biology. And with that, thanks for your attention. And I'm really looking forward to the questions.
Thank you very much, Georg. Thanks for this great overview. And yes, we have 10 minutes for questions. Shoot.
Cool. So thanks, Georg, for the talk. And we received quite a bunch of questions, and they are quite detailed.